Hello guys, my name is Yana Valenciana and the video that you are about to see is for my Counseling 5320 class, which is titled Theories of Counseling. The following video was made with my partner Madison from this class, and we're going to be doing a role-playing video. In the role-playing video, one of us is supposed to be playing counselor, which in this case it will be me, and the other one will be the patient. We tried to put it as a real situation, which she will be displaying that she has anxiety. And the whole role of the video is to show cognitive behavioral therapy theory. So, to kind of give an example of how it would look in real life in the field. So, this is what you are about to see. Please note that I am new to this. I am a student, so not everything is going to be ideally. The skills that you will be noticing are at least two of them. So what I tried to do in the video was try to identify what the problem was, obviously cognitively. Her anxiety was coming from her mind, right? And you will see that it wasn't really valid thoughts, but it was just thoughts that she had herself, not even thoughts that people have told her, but thoughts that she just had. So those thoughts would stop her from being able to be calm or to present accurately in any of her areas, such as just teacher to student or teacher to parent, or just giving out or even just socializing or just giving out a presentation. So I identified what the issue was. I tried to reframe it and see if those thoughts were actually valid or if it's just thoughts that she believed. And at the end, I gave her some homework to reflect. Something that we know in cognitive behavioral therapy is that homework is very effective. It takes the client from just hearing to actually doing, so that way in the next session it will be easier to know where the client is standing, especially because cognition and the thoughts that we have is a constant battle, and according to the thoughts that we have is according to our behavior. So if our thoughts are negative, our behavior is going to be negative, and if our thoughts are positive, then our behavior is going to be positive. And that is what we were trying to portray in the video that you guys are about to see. And yes, we will be talking a little bit more about cognitive behavioral therapy as you go along with the presentation that will be provided with the slides. And yes, I hope you guys enjoy. Okay. Hello, Madison. Good afternoon. How are you doing today?
Hi, I'm doing okay. Thanks for asking.
So what's new with you? How's this week been going for you so far?
It's going pretty good. It was the first week of school. The kids started back on Monday, so that was exciting. But of course, it brings all of these feelings like new kids that I'm not comfortable around and having to meet their parents. And so that's always really stressful.
And how are you dealing with that stress? Like, how do you manage?
Um, I'm managing okay. I have a close circle of friends that I talk to and kind of just update on how I'm feeling each day, and just kind of talk through the stresses. So that helps me a lot, but uh, it still is hard for me each day, especially, I guess like the longer I'm with a group of kids or like, the same group of teachers, I feel more comfortable around them. So starting a new year is always really, really hard for me.
And how have you been coping with it? Like, have you been able to handle it, like to talk to new people? Or have you been like a little bit like not really?
Yeah, definitely reluctant. And then even just like, I guess kind of like that approval thing. Like I'm like, do the kids think I'm the worst? Like, do they think I'm mean? Do their parents think I'm a good teacher? But I've been okay. I've been pulling through. It's just always in the back of my mind.
And why do you think that? That you're a bad teacher or that you're mean? Do you think you give off like that characteristics to the kids? Like, do you consider yourself to be a mean teacher?
Um, no, not at all. Um, I've never gotten that feedback. But I don't know. I guess I just want them to think that, I'm good at what I'm doing because I'm trying really hard. And so I want them to feel like, I'm nice and I care for them and that I am teaching them what they need to know.
Of course. And what do you feel you do that makes you a good teacher?
Um, I feel like I try to make them all feel heard and validated and supported. And then just kind of give them all individual feedback, like tailored to what they need. Some kids you can be harder on than others, but really, I just feel like putting in the effort. I know there's a lot of kids that don't go home to love, so just making sure that they feel that every day.
Well, that's good. That's what every teacher needs in their classroom, right? So can you tell me at least 5 characteristics that make a good teacher good?
Um, Definitely caring,
Okay.
understanding, uh, patient, um, kind, not judgmental. There are a couple that I can think of.
Okay, so from these characteristics that you just named, do you think you have all 5? Like you yourself? Because you mentioned
Uh,
you're caring because you value the kids' feelings, right? You've mentioned that
right.
you're also understanding because you understand that they're individual beings and that sometimes like they don't go back to love. So you try to give them that validation when you have them there in your classroom.
Sure.
Well, that makes you kind too, and at the same time not judgmental. So would you consider yourself to have those 5 attributes?
I think there's always room to improve, but definitely to some extent, I do.
Yeah. So what I would advise and what I would think it would be helpful for you to control this thoughts that you have of maybe I'm not good, I'm not a good teacher, maybe I'm this is go back to all the qualities that you actually have and the qualities that you're giving up. Especially because you're not getting this feedback back. It's you who's saying like, no, no, like I can't, I'm not a good teacher, it's them, it's this, whatever they're thinking. But in reality, well, you've told me yourself, right? You think you're caring, you know you're understanding. And it's not that you think you are, you're caring, you're understanding, you're kind, you're patient, and you're not judgmental. And when you believe it, I feel like you'll be able to be more of yourself, right? To not have these things holding you back. So
Sure.
definitely something that you could work on would be that. Mhm.
Thank you. That helps a lot.
No, no, of course. Something else that you would like to mention?
Um, I guess something big is beyond like the validation piece, like wanting to feel I guess liked. I do really struggle with like speaking in front of groups of people, like for like anything beyond like the classroom. I don't really like to, well, not really like to, like I physically cannot. I feel physically ill, like speaking in front of large groups. And then even just like initiating conversation one-on-one, even if it's someone that I don't know on a personal level, like even if it's just like a business, like casual relationship, like I know who they are, but I don't really know them well, I will not initiate a conversation, like even just a hi. I'm just going to keep it moving. And I know that's definitely something that I struggle with because people that don't know me will think that I'm rude, but it's really just like an anxious thing. I'm like,
Like avoided. So
yeah,
you
definitely.
mentioned that you feel physically ill. Can you like explain to me a little bit more about that?
Um, I guess not like I'm not gonna throw up, but like definitely like knots in my stomach, super shaky. My voice will go like super quiet, like um just really difficult to push through.
Yeah, of course. Are there something that goes through your head when you're in front of a crowd that you feel that makes you feel like that? Like you're like, okay, maybe I'm gonna stutter, or maybe they're gonna be judging me, or maybe my outfit is not correlating, or something like that.
Definitely. Yeah, all of those things. Or that I'm gonna or that I'm gonna mess up what I'm saying, or that they won't or always that like because I know that my voice goes quiet, like the whole crowd is gonna be sitting there and not hear anything that I'm saying.
Yes, of course.
Just
Um,
all the negative thoughts.
that just come through your head. And it
Yes.
doesn't only happen when you're in the crowd, right? It happens on one-to-one conversations, or is it different symptoms?
Different symptoms for sure.
So for one-on-one, what do you feel?
I just feel like the small talk doesn't come naturally for me. Like I can do the hi,
Okay.
and then I don't really know how to like either continue the conversation or end it when it's time to end it. Like I feel like those, and I think that's because I'm in my head as well.
Of course. Well, to an extent, it's normal, right? Like to feel nervous, it's always really, really normal, especially because we're not used to it. Our brain is not used to the stress and to feeling like that. But the thoughts that are going through your head and the thoughts that are stopping you, right? We could control those. So, as I mentioned before, the when you're in a crowd, like remembering your value, remember what you're actually given. That could also be very helpful in this situation to just be like, okay, before you go and give a lecture, to practice some sort of meditation to get yourself relaxed, to get your levels down because your anxiety levels are going to be very, very high. So it could work with meditation, and as well, as I mentioned before, remembering like who you are, right? So remembering that no, like people are actually not judging you, that people are actually not even worried about what you're wearing, or people are just there to actually listen to you. If they're there, it's because they want to listen to what you have to say.
Sure. Thank you. That's really helpful.
No, no,
And I think I really feel like it's all just like it's not as much about me as I think it is, you know? Like I'm worried about me, but no one else is worried about me.
yes, of course. It's always us trying to be like, like I want them to like me. I want them to prove that I'm good enough. But the person who you really need to prove that it's good enough is you, right? You have to convince yourself that you're actually good enough for you, for what you're giving, and that what you're giving is valid.
That's really helpful. Thank you.
No, of course. So for homework, we're gonna leave that just to finish the session today. What I want you to do is practice your meditation before making a conversation or even just making a presentation. And I want you to remind yourself all these good qualities that you have and what you're bringing to the table so that that way it comes to the point where you actually believe it. So it's not stopping you when you're doing it.
Okay, I'm definitely going to try that. And I'll have lots of chances to try that. So thank you so much.
No, no, of course. And we'll see each other on Saturday at 7. Is that fine?
Okay, yeah, that sounds good. Thanks. I'm feeling a lot better.
No, no, of course. Okay. Bye.
Bye.